My name is Laura Flatman. I'm a retention lead with NHS England and Improvement. And I focus on, as part of my portfolio, I lead on the retention for allied health professionals nationally. I also lead on the National Menopause Programme, which again is so relevant to the work that we're doing today. So it's lovely to be speaking in front of real people rather than a screen for the past 2 years. So bear with me as well as I get used to this new environment. Thank you. So a moderate level of staff turnover can be good for an organisation. However, it brings diversity, it brings development, it brings new ideas and people into the organisation. However, retention of a positive and motivated workforce is so important, especially for the NHS, and that needs more people. So over this presentation, I'll share with you our current priorities, look at what the data and some of the research is telling us, what's next on the horizon, and highlight what organisations could be doing to support their staff to stay and to stay well. And very poignant after the presentation that we've just had as well from our colleagues. So in terms of a background, so our retention programme was launched in April 2020, just as everything was hitting the fan, really. And we have been contributing to delivering the NHS People Plan. And it helps to deliver on the NHS People Promise by supporting ICSs and organisations to improve retention of their people by focusing on workplace culture, health and well-being, improving flexible working, and supporting staff throughout their careers. I'm going to go through these priorities, which are a combination of the strategic direction of NHS E&I, the AHP vision and priorities, and I know that there's a new strategy due to be launched very shortly, so that will change, but I do know that retention remains a key pillar in that. So we can see there about the people plan, that overall outcome, that AHP vision, delivering an effective supply of AHPs, and from that enabling the workforce to deliver and grow, and retention being support to AHPs, workforce to retain them. So the aim of the retention programme is to support our people to stay and to stay well. And from that, these are some of our key priorities. So we talk about that experience at work, which we've just heard so much about. And, very much around that flexible working, health and well-being, reward and recognition, EDI, going through that people promise. Then the generational perspective, so we know that we have got an ageing workforce as well, but equally the AHPs have a very young workforce too. So it's looking, and the data that I'm going to show you in a few minutes will show why we're prioritising these areas. So it's about improving the retention of early career AHPs, support for late stage careers, and we've done a deep dive as well as to what's happening in that early mid-career because there are so many leaving at that early stage. And then looking at those career pathways and opportunities. Many of the conversations I've had, many of the webinars we've had, have had a big focus around careers and what support there is for colleagues. So the next few slides, I'm going to show you are very data orientated, but I know from doing these presentations, people are interested in the data as well, so bear with me. So to support our diagnostic radiographers to stay and stay well, we need to understand why people are leaving and who is leaving and understand the demographics. I've worked closely with our analytical colleagues at Health Education England and NHS E&I to really understand what the data is telling us about the AHP workforce and also the diagnostic radiography workforce. And from that supported us to develop our key priorities. The following slides are an overview of some of the data which enables us to see connections between key factors in employee engagement, attrition and turnover, paving the way for actionable insights towards improved retention strategies. As I say, where there's data, there's insights. So this slide here is just to give us an overview of the diagnostic radiography workforce profile. So we can see here staff in post. This is looking at it over February 21 to February 22. We've had an increase, and you can see The average whole-time equivalent is 0.89. We've got 44%, majority of our diagnostic radiographers are in band 6, so reflecting what I've just said about career opportunities. And, that isn't the same for all AHP colleagues. I know that, for example, ODPs, the majority of them are in band 5, but this kind of reflects across AHPs in general. Age distribution, our average age is 40. We've got about 11.6% over the age of 55. Ethnicity, we've got 68% are white, 15% of our colleagues are Asian, and 10% of our colleagues are Black, African, Caribbean. 72% are from the UK. So just to really set the scene on the workforce profile. So we can see from this chart, the diagnostic radiography full-time equivalent workforce has grown on average about 3% per year. So this is looking back from January 2014 to January 22. Numbers have increased from just over 13,000 FTE in January 2014 to just over 16,500 in January 22. And growth, you can see the seasonal growth there from between about June and October, when we've got newly qualified colleagues joining the workforce. So the next one is around our leaver rates. And just to explain, when I talk about leaver rates, that are those colleagues that are leaving the NHS in total. When we talk about turnover, that's colleagues that are moving within the NHS. They may leave the NHS, but they may still be staying within the system, so they may be going to work in primary care. So it's, we've more work to do to understand where people are moving. The data we've all got from here is from electronic staff record. So that's why I don't have it from primary care, for example. But the graph shows leaver rates between January 2014 and January 22, a period of 8 years. And over that period, we can see, in general, the leaver rate has been lower than that for AHPs. So in green, we've got diagnostic radiography, and that orangey colour is AHPs. However, since 2020, we can see that they've started to mirror each other quite a bit. And then you can also see that dip, which was during the pandemic, how leaver rates went down quite significantly. And they've started to rebalance now. They've started to come back up again since 21, 20, and as we move in towards 22. The next step then is understanding what's driving those leaver rates. We talk about gender. We know in diagnostic radiography, men have higher leaver rates than women, but that gap has started to close actually since 2020. We know geography, we know London and South East have higher leaver rates, North Eastern Yorkshire and North West have lower leaver rates, and the East of England as well, which tends to have actually quite lower leaver rates. Higher leaver rates, but actually in more recent times, East of England, their leaver rates have actually not increased in terms of diagnostic radiography. We also know that ethnicity, white British, tend to have lower leaver rates. Our EU colleagues in Republic of Ireland have higher. And Asian backgrounds tend to have lower than average, while those from Black, African, Caribbean backgrounds tend to have above average. So this slide here is around age, and I've particularly pulled this one out because for me it's age and length of service are the ones that really stood out for me. The key one here is that looking at age, looking at that early career. Leaver rates and turnover rates tend to be higher than the average for staff aged under 35 and over 55, and that's the rates. Now, the rates are higher at later stage career because the numbers are lower. You can see those bars. But if we look at the numbers then, in terms of numbers, younger age groups are the highest leavers. About half of all diagnostic radiographers who left the NHS between January 21 and January 22 were aged 35 and under. So that's those actually leaving the NHS. And it's a noticeable spike around the age of 59 as well, so that would be the coming up to retirement. So the next one is around length of service. So in terms of length of service, leaver and turnover rates tend to peak within the first 5 years of service and beyond 35 years. In terms of numbers, nearly half of all diagnostic radiographers leavers did so within their first 5 years of service. Again, although leaver rates tend to peak towards the end of one's career, the evidence suggests the biggest FTE gains are found with those within less than 5 years service. So what's that telling us? Looking at this graph, the first 3 years in particular are crucial. So that's, thinking about preceptorship, think about onboarding, that support, those conversations that we heard so much about earlier, buddying, how do we support those colleagues for development? It's quite stark, really, that we have the amount of investment we put in to training colleagues and then recruiting them, and yet we're seeing these high leaver rates and numbers at such early stages. So these are just quite small writing, actually, apologies. Leaver and turnover, some other data key points. So we know that looking at 25 to 29-year-olds tend to have the highest leaver numbers, leaver rates lowest between the ages of 40 and 54. Agenda for change banding, band 5s spend the least amount of time, so around average of 23 months. I know that's less, again, for London. Length of service, the highest number of leavers had 1 year length of service or less. And in both diagnostic and therapeutic radiography, those with 15 to 20 years service have some of the lowest leaver rates. So that's just setting some of the background for you in terms of the data. Some of the reports, we know from our research shows that factors which positively influence staff retention are around job control, education and career development, good, meaningful conversations, work-life balance, resources, and recognition. I know there's been so much conversation about the Richards report today as well, and key points coming out of that were around talks about career pathways from apprenticeships upwards and development, expansion of that imaging workforce combined with a major drive to change ways of working, how that's vital in meeting increasing demand, and also development of new roles, flexible working, and it's vital, and also those lessons learned from COVID. Anderson, whilst that's about the therapeutic radiography workforce, I thought some of the key points are really relevant to here today as well. It's about letting the world know we exist, talking about what it is that we do as a profession and sharing that. They have a focus on early career in there, which is so relevant to our conversation today, and the importance of flexibility. I have made a small mistake in the next bit. I haven't written Nightingale there, apologies. But the retention of radiographers report from Nightingale et al., this report refers to improving retention as a rapid method of workforce expansion. 3 overarching themes across all radiographer professional groups were pulled out of this. So challenging working patterns that impact retention, challenging working patterns and the impact of health and well-being, lack of flexibility in working terms and conditions, and a lack of timely career progression and access to CPD and the need to feel valued. The study highlighted that failure to address these concerns will exacerbate the loss of experienced and highly trained staff from the NHS. So what have we been doing as a programme? So in terms of progress to date, I established the AHP retention workstream. We've got really strong and valuable leadership representation on that. We've got Beverly Harden and Joe Fillingham and many more AHP colleagues. That group has developed a plan. We have shared that widely in the regions and the systems through our programme, and we've recently updated it. We have a retention manager in every region, and they have a retention steering group that we ensure has got AHP representation on that. We have developed an improving staff retention plan and guide, which is in collaboration with NHS employers, and I'll share a little bit more about that shortly. We have a focus on early career colleagues, and I'm going to talk about that shortly as well. We're working with Health Education England to develop the preceptorship framework. A focus on data. This has been really important and really highlighting what the key challenges are, and collecting, analysing and sharing that. We've developed a retention compartment in the model health system that every organisation can access, And within that has got all of the key data colleagues need to be able to support their retention plans. So it's got all about the leaver rates, turnover rates, sickness absence, it's got staff survey results, everything that we need to support our conversations. Career focus, and again, working with Health Education England on that. And I held a webinar yesterday, which was attended by over 200 HP colleagues on careers. And it was so well received in terms of the conversations that we had about the different alternatives, the flexibility in careers as well. We've got the engagement, regions and systems. And as I said, we've just, yesterday was the final webinar in a series of 7 about the kind of the key issues and challenges faced by retention for allied health professionals. So what's on the horizon? So I'm going to talk through some of these programs in a moment. So we've got the HE Allied Health Professional National Foundation Preceptorship. We've got the Enhanced Clinical Practice program as well. We've got the National Menopause program. We're due to launch, we have a population of 77% are women in terms of our workforce, significant number over the age of 45, and it's really key that we are focusing on menopause for that because we know the impact it has. We know that 1 in 10 leave the workforce because of menopause. So it's really clear important that we focus on that. So over the next few months, we're going to be launching a national guidance, an e-learning for health module, and we're going to be developing more on that. We've been involved in the uniform survey on that, trying to improve the materials and the fit of uniforms. And we are working with the National Health and Wellbeing team as well to develop and support menopause champions in the workforce. And then finally, the Exemplar programme, of which Imperial is one of those trusts, and I'm going to be leading on that over the next 12 months. We're working with 23 NHS organisations on the Exemplar programme. So my colleague Helen Marriott is leading on the preceptorship programme, and she has shared these slides, 2 slides with me, just to give you an idea of what the timetable are for this programme over the next 12 months. So they're working with Health Education England and HCPC. We've got the Foundation Preceptorship Excellence Framework due to be launched around November, December. And they're going through all of the conversations at the moment, you'll see with HCPC, and then also collaborating with the professional bodies on that. So looking at what those principles look like, but then also the framework and then those profession-specific resources. So Richard, I know you'll be involved in those conversations as well as we move forward. The next one is about just sharing with you the Advanced Clinical Practice Programme, which has been led by Claire Ardito in the northeastern Yorkshire. And this is about maximising the implementation of that ECP apprenticeship across the HP professions to support the workforce upskilling, training and development. So just want to highlight with you some of those key programmes that are moving forward at the moment. What can organisations be doing to support their staff to stay and stay well? I'll move briefly through these, but we talked about the data. So it's understanding your demographic and your leaver data. Why are people leaving? We've got the ESR functionality and the NHS Improvement Model Hospital. We've recently been working with ESR as well to update the exit questionnaire. There was an exit questionnaire which is available to all in ESR, but it didn't include the question, why are you leaving? It didn't include the question, what could we do to make you stay, or what could have made you stay? So those questions have been updated. We now have 85 organisations using it, which is brilliant because we only had 40 in the first instance. So we're working hard to promote that because whilst we don't want to get to that stage where we're asking people that question, but we know people are leaving and we really want to understand why it is that they're leaving. So we encourage organisations to start using that. And that questionnaire is sent to the individual themselves. Nobody else sees it, so it will come back and they can include in there the reasons they're leaving and what could have helped them stay. Does your organisation have a preceptorship programme and support for early career colleagues? We know how important this is to supporting colleagues to stay and that support for them. International, that's one of our other priorities because we know that more and more international colleagues are joining the workforce and working with Kerry and colleagues recently to talk the work they're doing in the Southwest on that. And if we are recruiting more, we need to know what we can do to support them to stay as well. And there's a fantastic program called Stay and Thrive, which is been supported by my colleagues and in Horizon as well, to look at what we can do to support them and put that program in place. A big one there is those well-being and stay conversations. It's just those simple, regular conversations that are so important to people. And we've just done an insight survey with AHPs where we had over 700 responses and quite a significant amount from diagnostic radiographers. I only started to see the outcomes of it yesterday, but I know that well-being and stay conversations are just so valued by people so that they can have those earlier discussions with you. We see the amount of people leaving in the first 5 years. Does your organisation have a robust onboarding programme for new colleagues? What are we doing to recruit them? How are we supporting them during that time? Do they have a buddy when they start? Just simple things like mentoring as well. Has your organisation considered legacy mentoring for late career? We heard yesterday from Nottingham the excellent work that they're doing there on legacy mentoring. And then again, understanding why people are leaving, those exit interviews and questionnaires. Simple things around the side then as well. Raise awareness on pensions. We know how important that is to people to be able to plan for their future. Consideration around flexible working, that's coming back very strongly as well to us. And then that menopause support as well. I'll keep mentioning that one. So this is the guide I mentioned earlier. It's available on NHS Employers website and the NHS E&I retention web pages as well. Published in March 22, and it's updated to reflect learnings from COVID, and it aligns with the People Promise. It's a great resource to support the retention of your workforce and has key chapters relating to early and late career, focus on induction, reward, recognition, and menopause. I'm always asked who's doing things well and to share good practice, and I think it's really important amongst us as well to do that if something's working well within our organisation. So BNSSG in the Southwest have published a really great resource on portfolio careers, and it has 4 different allied health professionals in that resource, just talking about the different opportunities they have in their portfolio careers. NHS Employers have a fantastic international recruitment toolkit, which includes a whole section on retention as well. We've got the HE Legacy Mentoring Guide, and there's e-learning for health there as well. We've got the retention guide. We've got a whole section on our web pages on understanding your data from NHS E&I. The wellbeing conversations, and earlier in the year developed with our health and wellbeing colleagues, health and wellbeing brochure for AHP specifically, which is also available. And then that supporting development and career conversations as well. So finally, I'd like to say thank you for taking the time to listen to me today. The key messages for me are to know and understand your data, to support you to develop plans accordingly, understand why people are leaving, but also why do they stay. The majority of people stay, and I think we really need to understand why they stay. What resources are available to support you, sharing good practice, and having good regular conversations with your team. And I'll leave you with a quote from Jeff Viner, who's the former CEO of LinkedIn. And he said, start the retention process when this person is still open to staying and not after they've already told you that they're leaving. Thank you.